Hello, I'm Dr. Seema Nagpal, Vice President of Science and Policy at Diabetes Canada. Diabetes Canada is a patient organization that provides educational resources and information to patients and the public, as well as supports for healthcare professionals for their patients living with diabetes. Patients can visit diabetes.ca to get lots of information, as well as through guidelines.diabetes.ca.
Hi, my name is Brian, and I'm a person living with type 2 diabetes. I was diagnosed approximately 9 years ago.
Hi, I'm Shelley Diamond, and I'm a pharmacist and the president and co-founder of diabetescarecommunity.ca, which is an online resource for Canadians living with pre-diabetes and diabetes, and also for their caregivers and healthcare professionals.
Diabetes is a condition that is well known, but certainly not known well. Type 1 diabetes occurs when a person is not able to make enough insulin in their body or make any insulin for type 1. In type 2 diabetes, a person is not able to make enough insulin, or they're unable to use the insulin well in their bodies. Today in Canada, diabetes has reached epidemic proportions. 1 in 3 people are impacted by diabetes or pre-diabetes. That means that 1 in 3 people, like we have here today, will be impacted by diabetes in their lifetime.
Diabetes education has really changed over the years. It used to be that someone would go to their doctor, get a little bit of information about their diabetes, may or may not attend a diabetes education class where they were dumped with a whole bunch of information, and that would be the end of it. Now there is a lot more support through online resources, through use of an interprofessional healthcare team where they can access many different types of healthcare professionals. And there's also support groups and online chat groups to help them with their journey.
My journey began in the summer about 9 years ago. We were at the cottage and I was drinking a lot of drinks. It was hot outside, so there was really nothing I thought of as wrong. But then I also started to get up more frequently at night, and it wasn't uncommon to get up once at night to go to the washroom, but when that became 2 times a night, I started to notice things like that. So the unusual thirst and the frequent urination, and the third thing was that I had unusual fatigue. And so the example of that was I would take my kids to a baseball game in the early evening, 4 o'clock, and you'd have to wait an hour until they started the game. And sometimes I would miss the first pitch because I'd be falling asleep in the car, and I found that unusual. And that's when I decided it was time to go see the doctor. The diagnosis seemed rather routine once I made it to the doctor's office. Blood tests and urine tests confirmed it. Still, it's in my family. My mother and father had type 2 diabetes, but it was a shock and created a lot of anxiety and fear for myself, in that you start thinking about the unknowns and the fact that I have a chronic disease, and until then I've been relatively healthy and without need for any medications.
I think those symptoms and that fear that you experienced is quite common. And that's because diabetes is actually responsible for 30% of strokes and 40% of heart attacks and 50% of renal disease causing dialysis and 70% of non-traumatic amputations. It's a disease that leads to many other complications, and you had good reason to be scared. But the problem, I think, is that a lot of people are scared to get the diagnosis, and that's because of the stigma that they feel that they may have brought this on to themselves, or that they could have done something to prevent the illness, when certainly there are things that individuals can do to reduce their risk. Also, we know that right now we live in a disease-promoting environment. We live surrounded by advertisements and encouragement to eat in an unhealthy way. We live in an environment that promotes sedentary lifestyles, and so there's a whole bunch of reasons beyond the individual that contribute to the risk of diabetes that is not accounted for, as well as family history.
Brian, it's great that you went to see your doctor early on, because we know that diabetes is a progressive disease, and the sooner you get on top of your blood sugars, the lower your risk of having these long-term complications down the road.
So my diabetes education began with a call to my sister, literally on the drive home from my family physician. And she told me that, the diet that I was going to need to prescribe to was actually one that was healthier, and that it might be a blessing in disguise that I will adopt a better diet than I had been on. And so that made me feel a little bit better. And then I was provided a referral to an endocrinologist. And before you go to see them, you have to go to a diabetes education center and go through a session. And so that was my first real introduction to diabetes, formal diabetes education, where they sit you down in a large room with a whole bunch of other people who have the same type 2 diabetes, and they educate you on different food types and what you can and can't eat, and talk about different medications and what your A1C, blood A1C, or your glucose A1C levels are, and what you need to do to test and how you test, and take you through all the different things that you need to start thinking about as a newly diagnosed patient.
It's interesting that you mentioned that your sister's a dietitian, because access to multiple healthcare professionals is really important in the care of diabetes. Dietitians, pharmacists, foot care specialists, ophthalmologists, many healthcare providers can help patients with diabetes achieve the best possible health outcomes that they can. I think it's really important to have all of these professionals part of the care, because we want to make sure that the risk of complications is reduced as much as possible. That includes screening as well as management of the complications as they begin. And all of these professionals together focusing on your individual clinical context has been shown in lots of research to make sure that patients are achieving the best care possible.
So many people, when they're first diagnosed, try to manage it with diet and exercise, and some people are successful with that. But as we know, diabetes is a progressive disease, and so many people will end up having to go on to medication. In fact, some people could even be prescribed medication the day they're diagnosed. It just depends on their blood sugar levels and some other patient characteristics.
Yeah, so I began right away. So I was one of those who had a very high A1C number value, and so they put me on medication right away, and on various oral therapies over the course of time. They've now transferred into long-acting insulins and other medications, and I really became obsessed with the A1C. I'm a numbers guy, so I was focusing on the A1C and trying to keep that thing in check, and every few months I'd go back to see my family physician, and they had to do blood work to do your A1Cs, and we would do that, and we keep tracking that number. My other number that I followed often was my fasting blood sugars. So first thing in the morning I do a finger prick and see what that number is, and it was one that I tracked religiously for a while. And the problem with that is now I discover that it's not the only metrics that we should be looking at when we're talking about diabetes. In the fall of last year, I had a triple bypass surgery, which means I have had a major complication, and I thought I was managing my diabetes pretty well, but side effects or not side effects, but exacerbations of that disease have caught up. And so it tells me now that you need to be thinking about more things than just the numbers of your blood sugar, but you need to be thinking about the long-term risks, which you were talking about earlier.
That's really important, because our clinical practice guidelines, which are published by Diabetes Canada, our experts describe how a person with diabetes should be assessed, in that a person needs to have their A1C assessed, and that needs to be managed. But B, blood pressure should also be considered and should be falling within normal range. C, that cholesterol should be assessed, and if that's not managed well, that should be targeted as part of diabetes management. D, that a person's cardiovascular risk should be assessed, and medications may need to be added to manage that cardiovascular risk. And E stands for exercise and eating in a healthy way so that a person is able to minimize any risk associated with complications, as well as to help manage their diabetes and their glucose management. And then finally, there's 3 S's as part of that management, which is smoking cessation, and as well as screening for complications, as well as self-management, which includes kind of a catch-all of stress management, mental health, and ensuring that you're educated in terms of how you can manage your own condition very well. So together, that A, B, C, D, E, and 3S, together that algorithm provides kind of a guideline for how a person with diabetes and the risk factors should be managed.
And if I can pick up on the education part, I think it's really important for patients or people living with diabetes to make sure they're their own advocate. Not everybody across Canada has access to a diabetes education center. And so you then have to make sure you're on top of the information you need and make sure that you are asking your healthcare team about some of these management issues and some of the monitoring issues as well, to make sure that you're doing what you can to reduce your chance of getting complications.
My education into diabetes began at the education clinic, but it was only a beginning, and it's really been changing over time, over the many years, and I continue to learn today. Things like diet, which seem the most obvious for me, and the things that I can do personally to make change, it was easy at the beginning. You know, you were motivated, you were scared, you were trying to do things that would help alleviate the disease, even though you can't feel any of the symptoms of it. I knew that I had to make those numbers go down, and so very motivating in the beginning. The problem is as years go on, you start to lose that fear and you feel normal, and so you start to lose the motivation to maintain those things like a super strict healthy diet where you restrict those things that you would normally love. For me, things like ramen and noodles and rice were very hard to resist, and so you start to fall down over time.
I think that's fairly common, is that people find it really hard to change their lifestyle. That's why people need support from diabetes educators and dietitians to help make lifestyle changes that are sustainable over time. Having said that, even with that support, I think a lot of people find it really difficult because of their life circumstance. The cost of healthy eating is a lot higher than eating foods that are processed or quickly prepared. The cost of joining a gym or of joining an exercise class is sometimes higher than what people can afford. And if you're somebody who is holding 2 part-time jobs, it's really hard to get to the gym. So some of those lifestyle changes are difficult to implement if you don't have the circumstances to allow that, as well as the financial means to make that happen. So reducing your risk for developing diabetes or for developing complications is something that everybody wants to do, and with support sometimes you can do. But I think we really need to think about this as creating an environment that promotes health rather than the current environment which we live in that really helps people be ill. So if we could really focus on the system supporting people rather than the individual holding all of that responsibility, where they can't make a lot of the changes individually that we're asking people to make. That's something that I think that we really need to pursue more here in Canada.
Brian, it's great that your education has been ongoing, and it is such a steep learning curve for people when they get diagnosed. They have to learn how to eat healthy, how to exercise, how to do monitoring of their blood sugars, and how to monitor for any complications. And all of that is a lot of information to take in. And just trying to change your diet is a challenge on its own. And one of the best things, I think, is to tell people, and maybe you had this experience, but changing one thing at a time and seeing how that works for you in your life, and instead of trying to do it all at once.
The clinical practice guidelines are certainly a great resource for healthcare providers and for patients.
Now we have so many more choices in terms of drugs for type 2 diabetes patients that can be used in conjunction with diet and exercise to help protect patients who have increased cardiovascular risk and to assist obese patients with losing weight. So now healthcare professionals can work with their patients together and individualize therapy based on their specific needs. It's also important to make sure you, as a patient, ask your healthcare provider about some of these medications as well.
I think the best advice I could give is to be your own advocate, to think about, how things that you can do and to keep learning. You always have to keep learning. I think about going to visit your physician and making sure that you are asking the right questions and talking about risk. When I think about type 2 diabetes now, I think about it as a metabolic disease, not one of just measuring blood sugar, that I need to be thinking about cardiovascular risk. Well, even though I've had surgery, I still have those risks, and all the different arteries of my body are doing the same things that they fixed in my heart. And so I think about these things and strategies and ways that I can now treat my body so that I can have the best chance. So you got to keep learning. And where do you go? Well, you go to websites and you go search online and stay active in your journey.
Yeah, we know that online research for health conditions is the #1 thing. People go to their computers or their mobile phones, which are even more popular now. And diabetescarecommunity.ca and diabetes.ca are two great resources where you know that you have objective information that is reviewed by healthcare professionals, and you can start at least getting to know what you need to talk to your healthcare team about as well, rather than them talking to you.
It's always important to ask the right questions, and how do you know which questions to ask? And so I think making yourself more better informed and finding out what you don't understand, figuring out what you don't understand sometimes is half the battle. So I agree. If going to reliable websites, calling our 1-800-BANTING line where you can talk to somebody and talk through what resources are out there and how you can figure out where you can access particular services in your community, or even the type of information that you should take in to your physician visit so that you can discuss these issues with them. I think that's a really important part of the journey that a person experiences as they live with a chronic condition like diabetes.